Before we dive in, we want to shine light on today's featured guest company, Anarti Therapeutics. Anarti means painlessness in Sanskrit, and their mission is to combine the wisdom of Ayurveda with the science of CBD to help people reclaim their lives from chronic pain. With plant-based formulations that integrate CBD, CBG, and CBC alongside Ayurvedic principles, Anarti offers natural solutions to relieve pain, improve sleep, restore cognitive clarity, and renew resilience. Welcome to OptiMindX podcast, where we sit down with entrepreneurs and innovators who are shaping the future of business, health, wellness, and technology. OptiMindX shines a light on real insight, both the triumphs and the hurdles, highlighting what clients truly want rather than just what's trending. Today, we're joined by Alka Badshah, founder of Anarti Therapeutics. Alka's journey is deeply personal. After being diagnosed with fibromyalgia, she endured years of pain, fatigue, and sleepless nights, cycling through medications with little relief. A turning point came when she embraced Ayurvedic practices and later the science of CBD. Through her own healing, Alka discovered the transformative potential of combining these two powerful traditions. She found Anarti Therapeutics to share that path with others, especially the millions suffering silently from chronic pain. Alka, welcome to the show.
Thank you so much. Thank you for having me today.
Thank you so much, Alka. So we're going to dive into your background and entrepreneurial journey. So Alka, can you share the turning point in your personal journey with fibromyalgia that led you toward, I don't know how to pronounce the word actually. Ayurveda and CBD as solutions?
Sure. So a quick thing about my background. I come from a technology background. I actually trained as an architect, and I was working for high-tech companies. My last job was with Microsoft, and I was diagnosed with fibromyalgia about 25 years ago. And even though I took a break, went back for another 3 years, but it became too much to manage with fibromyalgia, the pain and the fatigue. So I had to basically make a decision whether I kept going, or because I have 3 sons, I have a family, so something had to give in, and unfortunately it was the job. I struggled with various prescriptions along the way, finally coming to a prescription which was kind of working, but I was putting a pound a week. And that's when I said, this is not sustainable. I need to do something else. So I decided to give up all the prescriptions and basically just went on ibuprofen for a year and then to Tylenol for a year. And both of them, although they helped with my pain, they didn't help with other symptoms like fatigue, like mental fog, and all the other things that you get with fibromyalgia. And then besides that, ibuprofen is not good for your kidney and Tylenol is not good for your liver. They're not really designed to be had every day. They're for occasional use. And I was taking 2 in the morning and 2 at night. So that was a heavy dose.
Right.
And in the meantime, I was working for a CBD company and did a lot of research on CBD. I had gone through Ayurvedic treatments before, so I decided to combine them. I found a manufacturer in Colorado and formulated based on my experience, and that's why the 3 CBD variations of CBD, CBG, and CBC, that was through my experience and how they benefit. So that's how I came up with that formulation. I'll take a little bit of a pause in case you have any questions. So far.
Yeah, on the note of when you say architecture, were you working in like infrastructural architecture or system architecture?
No, building architecture. I did my undergraduate in building architecture and then moved to computers.
Nice. Amazing. Okay. I'm an architect myself, so.
Okay.
Yeah.
I find architecture to be a good all-rounded training.
Oh, okay. Definitely. I definitely can relate with that. So what was it like moving from being a patient to becoming a founder of Anarti Therapeutics?
Well, In some ways, because I was in high-tech company, I was an exec at Microsoft, I knew how to run a business. It was a technical business. It was a different kind of business, but I knew how to kind of run a business. And I've always been interested in research, in finding out things. Initially, I did most of the experimentation on myself before I made it available to others. I tried it in terms of the strength, in terms of what happens if I stop it. So whether it has any effects in terms of whether it'll stop working or whether I'll get withdrawal symptoms. So I did a lot of experimentation on myself. And when I was comfortable that those were not the issues, then I brought it to market. Later on in the podcast, I will talk about one of the highlight cases that we've seen, which I'm really, really proud about. So,
If I may, how long did you experiment with yourself until you finally transitioned into solidifying this into Anarti
right.
Therapeutics?
So I gave up any prescription or OTC about 5 years ago. And so 5 years, I've not had any pain medication. So the first 3 years, I was experimenting with different kinds of CBD with commercial products. And I was buying products from the manufacturer that I ultimately chose because I liked their morality, their integrity, and the fact that they were testing it properly. And the owner there is a veteran himself. So I just like the background of the company, and they are a manufacturing company in Colorado. So I was buying products from them, and from what I was buying, I kind of formulated what I wanted to do. So I think about 3 years I used their products, and then I formulated mine. We went through a few iterations. I wanted to make sure the strength was correct. What we added was right. Like we wanted to add ashwagandha, but ashwagandha didn't mix well. So then we came up with adding holy basil, which is also tulsi, which is actually an adaptogen, which actually worked out to be a better choice than ashwagandha. Because it's an adaptogen, it helps you with whatever your body needs, whether it's physical, mental, emotional. So it kind of adapts to whatever is needing attention. So after experimentation, and we went through a few iterations, I formulated it, decided on the formula. Then I tried that myself for a couple of months. And once we were sure that that was working, that's when I did the commercial manufacturing in at scale. I designed the labels. That's when I decided to go commercial.
Okay. And what were the first signs that you were onto something, that others were resonating with your formulations and your story?
So my story has really touched people, and that actually helps them understand that it can work. What has not happened, and which is what I'm trying to do, and I'll talk about one of the cases, is people who have such chronic illnesses and are suffering so much are skeptical in giving up their prescriptions. And it was not easy for me either, because I tried the CBD in parallel to my prescriptions initially. And only when I was comfortable that it's working did I just stop taking anything else. So I understand that people are not comfortable just giving up. And so what I advise them now is take it in parallel to whatever and you can taper up and taper down your prescriptions and taper up the formulations if you see it's working. I now have somebody who's ex Amazon who has a similar condition. She tried my formulation and loved it. So she's actually coming on board to work as an executive with the company. So it's a process, because it's not like a pill that you take and your headache goes away, or it's a process that works with your body. So you have to give it some time. 5 to 7 days is what I recommend. So I think that is my biggest hurdle right now in people adopting. But while we are waiting for people with chronic illnesses to adopt it, people have really found benefits in the sleep, stress reduction, anxiety reduction, some cognitive benefits. So some of the benefits that I told you about, I now can focus and accomplish my tasks. I work all day. I couldn't do that before, even when I was on other painkillers, because it didn't give me that mental clarity. Mental fog was still there. So all those benefits came with time that I know I'm getting from these formulations.
Absolutely. That's really exciting, really, to hear. Having these milestones, what have been the specific milestones, like feedback from fibromyalgia warriors like yourself and others that you've also shared that you've connected with and have tried that gave you validation early on?
So couple of validations. One is I've actually done a scientific study on the formulation itself, the oil, and they tested for, we have something called cytokine, which are proteins in our body, and everybody has them. You need them because that's the mechanism that when you're injured, your body tells the brain that this is where the injury is and that's where you get the pain so the body can repair itself. But what happens is that sometimes they get out of whack. So there's overproduction of these cytokines. So your body is sending the pain signals even when you don't have an injury, when you shouldn't be hurting, your body is hurting. So we did a study to figure out what is the effect of this formulation on those cytokines. And when I got the tests back, I was excited to see that there was 40 to 70% reduction of these cytokines through this formulation. And that study is actually on my site if you want to see that in detail. But there are three cytokines that cause the pain that are related to inflammation: IL-6, IL-8, and TNF-alpha. IL-6 got reduced by up to 75%, and IL-8 by 38 to 50%. So when I got the results back, that was a validation that uh, I knew it was working for me, but that was validation as it said, yes, it actually does work. There's a scientific validation. That was one thing. And then I now have somebody in Norway, a 12-year-old girl, who was born with some spinal issues, and she has been in pain all her life. She has pains, she gets very tired, and she gets spasms. So she's gone through all kinds of testing. It's not degenerative, but she's lived with that pain. So she started taking it about a month ago, the oil formulation. She takes once a day. She stopped all her pain medications, and she's without any pain.
Amazing.
From day one. And that was, her mom, of course, is thrilled, and she said, "You're God sent," and so on. But this was a real validation. This was somebody who was willing to try it with that kind of pain for three reasons. One is because the doctors had basically given up. They said, all we can do is physiotherapy, and she was taking Panadol and Tylenol every 4 hours, because she said the effect lasted for 3.5 to 4 hours. So she would take that. And then she got other issues like acid reflux and stomach issues and all that. Now she just takes this once a day and has stopped everything and is painless. She has more energy, deeper sleep. The real validation came to me when her mom said that when she went back to school, one of her friends asked her, "Did you have surgery this summer? You don't seem to have any pain anymore."
Wow.
So that's why I'm saying that I think I would just like people to try, even if they don't stop and what they're doing. And we have return policy, it's no risk. So because this thing works, it's worked for me, it's worked for other people who've tried it. I think people need to just get over that hump. And I know, I mean, people are skeptical about CBD, but our oil, which is ingestible, has zero THC. That's on purpose. So there is no THC at all. The CBD is hemp derived. And like I said, the formulation that we have, which you talked about, is CBD and CBG and CBC. And I'm going to take a minute to talk about the benefits of these. CBD, I think everybody knows it's beneficial for health and even feeling calm and all that. CBG is the one that gives you cognitive benefits. So that's the one that's helping you with stress, anxiety, sleeping better, and the mental clarity and all that. And CBC is the one that helps you with pain. And there's a reason that I formulated it with all three in the proportions that it has. The other reason that CBC has not been so popular still is because it costs 10x as much as CBD. So CBD is $800 a kilo and CBC is $8,000 a kilo. I checked with my manufacturer, and to his knowledge, I mean, I couldn't find anything which has all three of these, and he validated that there is nothing else that combines all three. You will have CBD and CBG, and you will have CBD and CBC, but not all three. And I think that, along with all the benefits that the Ayurvedic oils are giving you, really makes it a powerful formula.
Wow. It's a very wholesome concoction and very unique. I have heard of CBD, but the other two and the last one you said is CBG, you said?
CBG and CBC.
And CBC being the one that's a higher tier, a little more expensive, or a lot more expensive.
Yeah.
Very unique to the market, absolutely.
So then going back to the early ons of your business. So in the early days, what were the top challenges that you faced by building Anarti? And then today, as you grow, what are the biggest bottlenecks you're working through, whether around education, stigma, scaling, distribution? So can you run us from the beginning to like now what you're facing?
Sure, all three of them actually. There is some stigma, even though this is fully legal in all 50 states with the Farm Bill. Hemp-derived CBD is fully legal. I can ship it to any state in the US, and I'm trying to see how we can get it beyond US. We travel to UK, and people in UK seem to be much more open. I was surprised there was a whole shelf of the products in Harrods. So it's much more open there. And so people really wanted it. And so I'm trying to figure out how to get there. So stigma is one. The other thing is that I really would like people who are really suffering to be able to try it. And there is that you have to take a leap of faith.
Yeah.
Because and I know for a fact that if they go to the doctor, a lot of the doctors are not, because it's been Schedule 1, it's an oxymoron. It's legal, but it's Schedule 1. So the doctor, there's not a lot of FDA research on it, and so doctors don't believe in it.
If I may, so for us, including ourselves that don't know what Schedule 1 is, could you share what that is?
Yeah, so Schedule 1 is like cocaine and all that. So Schedule 1 is, but cannabis is being Schedule 1, and because CBD is also related to cannabis, it automatically is Schedule 1. We're trying to get it to Schedule 3, which is why I said it's oxymoron, because with the Farm Bill, CBD, hemp-derived CBD, is fully legal in all 50 states. But because it's Schedule 1, FDA has not done much research, doctors don't believe in it. So that's an issue with people adopting it. And distribution is not been a problem yet because it's a e-commerce business, so it's fully available. I am trying to get it to some physical spaces like gyms and naturopathics and so on. That's taking some time. And so otherwise, anybody who wants it can get it today from online.
Okay. And CBD and Ayurveda can both be misunderstood, hence what we were just discussing and what you were sharing. How have you educated people and build trust around your product so far?
So part of it is the website. It talks like this, and that's why I'm going on podcasts. And also Ayurveda is actually a 5,000-year-old science. It's an Indian science which is 5,000 year old. It was forgotten in favor of the allopathic medicine, but people are now realizing that it's so much better. The two other points that the mom told me she adopted was, first of all, nothing was working. Two, she read my story and she kind of knew about me, and she said if it works for her, it might work for my daughter. And the third reason was that she said it's all plant based. At the most, it may not work, but it's not going to harm you.
Right.
So it's not negative effect. It's 0 to 100%, and in her case, it was 100%. So there's no risk that's it's returnable. So there is no risk in doing that, in taking it.
Okay. And on that note, I know you said the website are strategies or channels that you've used in reaching individuals. Are you using any other channels that are effective that help you reach people that are struggling with chronic pain and looking for natural solutions?
I'm trying to find more. I've advertised on the Meta platform.
Yep.
That was not very successful. I think it was not reaching the right people. I think on the face of it, the price is an issue, because it's easy to buy a $5 toothpaste on an impulse, but it's harder because you don't know how beneficial it's going to be. Before I had my product, I was actually paying that much per month to get these formulations from the manufacturer that I mentioned. And the balm, my massage therapist really loves it. She buys it from me from wholesale and she resells it. And I've had some of her customers come to me and say, we got something from cannabis store which was more expensive and less effective than your formulation. So I think the word is getting out, but I think the price point might be a deterrent in the beginning. I've thought about whether it makes sense to reduce the price, but it's one of those things that when I priced it, I did the research of competitor products, and they were priced anywhere from $80 to $150 for the comparative product. So I kind of priced it in between. But I think that's what people need to kind of learn about, and that's what we need to teach people. The price is because, first of all, it is tested. All the certificate of authenticity is on my website, which tests for everything. It tests for pesticides, it tests for the metals and anything, biotoxins, and of course the content of CBD. So that is not available on every product. So, you can buy CBD gummies, for example, for $20, but what I'm told is that might have 5 to 10 milligrams of CBD. And it doesn't have CBC. So I think we have to educate people that yes, the price is higher, but there's a reason for that.
Right. So on that note, how do you see social media evolving for wellness brands like yours, especially in spaces where regulations around CBD can limit marketing?
Yes, so I have had influencers tell me that they don't even want to touch CBD products. And when I tell them that my product has no THC, they're a little bit more open. But I think they are afraid that it might tarnish the other products that they are promoting.
Okay.
So I have to find the right influencers or right people to be the spokesperson for me, and that's work in progress. I've tried, for example, the social media, but that did not target the right people, I think. And I think it's also not an impulse buy.
Okay. So then just diving a little more now because, AI is a big part of everybody's business now at some point. So with AI reshaping health and wellness industries, how are you thinking about adapting or implementing AI, whether for customer education, product development, or scaling Anarti during this pivotal moment?
So I use AI heavily for my own research and for doing the background work. I have not used AI to do the front end work. I have relied on, I know Meta, for example, uses AI to figure out who to show the ads to and all that. So I've relied on that. I have not directly done any targeting based on AI. And that's something that I need to do.
Okay. Okay.
And if you had a magic wand to fix any challenge, and you might have touched on it in the CBD and wellness industry, what would it be?
I think right now I am addressing chronic pain for a couple of reasons. One is it's a big problem. It's an unseen problem. When people are suffering with chronic pain, they're suffering in silence. But there's lots of productivity loss. I had to leave my job. I was pretty high up and I had to leave my job. And that's a loss of productivity for the company, for the country. And so there are about 3 to 7 million people in the US that are suffering from fibromyalgia itself. There are 50 million people that are suffering from chronic pain in the US. If you go look at the global population, there are about 3 to 5% of the global population that is suffering from chronic pain. And that's not only just loss of productivity, that's loss of life. It's a quality of life. There are people who cannot do basic tasks. I could not even lift a glass of water, which was my low point, which is kind of what woke me up and said, I can't live the half of my life like this, which is why I jumped to action. So there is a lot of people who are suffering and I think there's a lot of education that's needed even from two people who are not suffering, who are caring for people, even at work, because like I said, this is a silent disease that people do not realize. It's like having flu all the time. But when you go to work, when you have this, you go to work, you don't have an injury, you don't have a broken leg or cancer or something, so nobody thinks about it. And then if you're taking time in producing something, they're questioning you. They think you're lazy. You're not producing what you're supposed to produce. So there's a lot of loss of productivity. There's a loss of your self-esteem. There's a lot of frustration. I was a type A personality in terms of achieving my goals. And then suddenly I couldn't do anything. I couldn't achieve anything. I couldn't even take care of my kids. My husband was stepped in. And that leads to frustration and depression. And that's the way it's affecting the societies everywhere, because people are suffering in silence and we can turn that around. So my logo is, we want to move people from surviving to thriving, which is what I have moved myself to. From surviving, just, what is the point of living a life when you can't really live a life, to thriving.
Absolutely.
So going back, because you said that your lowest point you couldn't even lift a bottle of a cup of water. So when you started this, if you go back to day one, what would be something that you would do differently on launching Anarti?
I think telling my story, it seems to be effective, because now for 5 years, like I said, I have not had any medication, any prescribed medication for fibromyalgia. Not even, I mean, there was a time at the height or low point, I don't know whether to call it the low point or the high point, of fibromyalgia, I couldn't walk a block. Now, when we travel, I walk 15,000 steps in a day. That's a big change, and that's all because the way I'm saying is that maybe that day I'll have a Tylenol because it's been a lot, but I don't otherwise on regular basis like I was taking before. So it's been pretty much any prescription free for 5 years.
Okay.
And I'm doing better. I have much less pain. I might get tired if I want 15,000 steps, but I think anybody would.
Yeah, yeah, definitely 100%.
But otherwise, I'm working all day. I'm able to focus. I'm able to um, do things like this, which I couldn't. I couldn't sit for an hour and do a talk like this. I could not write. I could not focus for even 15 minutes. Now I can do that. I've seen a lot of cognitive, physical benefits, and the depression is gone. At the height of fibromyalgia, the frustration led to depression, and now I don't have that.
That's so amazing to hear and very reassuring for those who are listening that are experiencing this in their own lives and connecting with what you said that it is a silent disease. It's something that, since you don't have it physically visible, individuals aren't seen and they don't know that this is happening on the outside. So it's really amazing to hear your story. And on that note, this is more than just about pain relief. Like you said, this is about reclaiming your life. If it has your mission evolved since launching?
It has widened a little bit. When I launched, I thought I was just going to help people with chronic pain and fibromyalgia to start with. Now, having seen other benefits, I've widened. And frankly, people, even young people like 30s and 40s, are getting it because everybody's stressed nowadays. Everybody has sleep issues. Not everybody, but people have anxiety. And so this is helping them a lot. I mean, even the friend that I talked about, she said, I couldn't even think clearly. I couldn't do anything for even half an hour. Now, after having this, I'm amazed at how much I can achieve in a day.
And with all these years in a professional and personal experience in alternative health, what keeps you motivated when challenges rise?
I'm a problem solver. So, that's when I go to AI or I do my research and figure out what is it that it'll take to solve the problems. Right now, my biggest problem, I have a product that works. I have manufacturing that can scale, so I don't have any of those issues. The shipping and all that, the 3PL is working just fine. My issue right now is reaching more people and marketing and getting the message out and having them take that first step.
Okay.
Right. So, I mean, obviously you've had an incredible journey so far. So, what is the main goal you would like to achieve with your business in the next 1 or 2 years?
So I want to scale it both in adoption and of course uh, production will scale as the adoption increases. Maybe place it in some of the physical stores and then widen the line. Right now I have two products which are the core products. One is the balm, one is the oil which you take ingest that. So I want to then expand the line which has to do with quality of life, like maybe salts, maybe different form factors that allow people to carry it anywhere. The oil actually tastes really good. Both my products, they don't smell or taste like hemp. So my oil has, because it has ginger, turmeric, and holy basil, you actually get teas that have the similar flavor. So you can put it in hot water and have it like tea, which is what my daughter-in-law likes to do. And so it's like tulsi, ginger, turmeric tea. So I want to expand that, maybe make the tea, maybe make the spray, maybe do the gummies, capsules, so it's easier to travel with. And so it will be an expansion of both form factors and more products.
Okay. So now we're hitting the rapid fire of the podcast.
Okay.
We have 3 questions. It is either a word that resonates or a sentence. And the first question is one lesson you'd tell your younger self.
Not to have fibromyalgia. I think that was brought on by a combination of stress and all that. Wouldn't change much. If I hadn't got fibromyalgia, I would have had a different trajectory. I worked through, I said I have 3 sons. I worked through most of their childhood. And I tell people that given a do-over, I think I will still do that. And the reason being that it may have been hard at that time, but kind of respect they have for me as a career woman is different. They come to me for advice on their career, so they can talk to me at a more professional level, which I really like. So
Okay.
that was not a rapid fire, but
No, that's fine. I
That's
think
still
that,
good.
that still counts.
Absolutely.
So, one breakthrough tool, strategy, or partnership that accelerated Anarti's growth.
The breakthrough, one of the examples that I gave with this 1200, that has really justified my purpose. I mean, my purpose was to do this, but having seen people like that, people getting so much benefit from it, her mother just keeps saying you're godsend, you've totally transformed her life. Getting a text saying her friend asked her whether you got a surgery, it just propels me.
Absolutely. And then the last question in rapid fire, one current trend in wellness and chronic pain management you're most excited about.
I think one trend that we are seeing is people realizing how much harm the pharmaceuticals and the chemicals do to their body. A lot of industry is moving to plant-based and natural solutions. And so that I'm very excited about. Whether I had Anarti or not, I think that trend is happening. Even younger people are giving up alcohol, for example, and going more towards hemp and more towards natural ways to get calm or whatever. So I think that trend is a wholesome trend. I'm waiting for it to get from Schedule 1 to Schedule 3 so FDA can do more research and it can get more credibility and validity.
So, to close up the podcast, our last question, as a founder, leading in such a personal mission-driven space, what qualities do you value most in your collaborators or team members? So far, the people that we have interviewed have really resonated with grit. So, what were things that you resonate with, or if grit is one of the things that you value?
So grit, obviously, the person who can actually solve problems can come up with new solutions. So, for example, right now we are having issues with marketing and reaching. So, find new ways of reaching those goals. I think we know what goals we have. I think we know we have something that works. I think we need to figure out how do we reach more people. So, anybody who can help me think through all those issues and help me with that is the person. And of course, I'm a problem solver. I don't give up. And so those are the qualities that I don't suffer fools.
Right. Amazing. That's an amazing answer.
So, Alka, thank you so much for sharing your story and insights with us today. It's been truly incredibly moving to hear your transformation of your personal journey with fibromyalgia into a mission that helps others reclaim their life. Anarti's fusion of Ayurveda and CBD is such an inspiring example of tradition and science working together. And to all our OptiMindX listeners, thank you for tuning in. We hope you found as much value in this conversation as we did. If you enjoyed today's episode, be sure to subscribe, share it with a friend, and keep the conversation going with us on our platforms. Till next time, OptiX listeners and Alka, thank you again, and we'll talk soon.
Thank you so much. Thank you for having me.
It was a pleasure, Alka.